The main mission of the UW Health Digestive Health Services is to provide top quality, integrated and comprehensive care in digestive disease and hepatology to our patients. The innovative part of the UW Health Digestive Health Centre is that it's both comprehensive and multidisciplinary, and so it allows patients access to a broad range of services and access to both innovative therapy, new research and high quality delivery of care.
For the clinical care of patients, it's that multidisciplinary one-stop care that we can provide them that makes us unique.
In the setting of a comprehensive digestive health centre here at the University of Wisconsin, the expertise ranges from research and practice to improve the practice of gastroenterology through basic research looking into the genetics of colon cancer in mice, for example.
We have a mouse model of human colorectal cancer that has a mutation in a gene called APC that gives these mice 100 to 200 tumors. And humans have a mutation in this gene. They can be born with a mutation in this gene. And those individuals that develop 1,000 to 2,000 tumors in their colon by the age of 20, and they have to have their colon removed. So we're fortunate to have a mouse model of what's happening in the human. What we really use that model for is really two things. We want to understand the tumor biology. How the heck do these tumors form? And then we want to use those models to try to develop new treatments. Can we test experimental drugs and see if they're effective before trying to do clinical trials? Beyond the work that we do with our animal models, we also work with our colleagues in the clinic to try to identify better ways of identifying patients that have colon cancer or hereditary forms of colon cancer.
My clinical life focuses on high-risk patients, and that would be patients who have potentially a family history or who are at risk for hereditary colon cancer syndromes such as Lynch syndrome or FAP. We have the GI Genetics Clinic now in the new Digestive Health Center, which is a clinic run by myself, Dr. Mark Reichelderfer, as well as Amy Stetner, who is one of our genetics counselors. And in conjunction, we see patients and their family members to assess their family history and their personal risk of these hereditary syndromes. We go over the genetics of these syndromes with them, as well as our pre-test probability that they might have one of these, and then talk about the possible genetic testing we can do to prove whether or not they have one of these syndromes.
Virtual colonoscopy, or CT colonography, is really not much more than just a CT scan. The patient has simply undergone a low volume bowel prep the night before, and before the scan we gently have to distend the colon with low pressure carbon dioxide. The scan itself takes about 10 minutes. It's then read using advanced software by the radiologist. What we found is over time, through our prior trials, we've shown that it's just as effective as the more invasive colonoscopy for detecting the polyps that really matter.
Virtual colonoscopy, we have one of the premier programs in the country, if not the premier program. The first program in the country that had insurance-covered virtual colonoscopy.
We went to the local medical directors of the HMOs, the insurers, and convinced them to cover the exam by insurance locally. This is about 10 years ago now. We're still the only program in the country with that kind of coverage.
What I think that separates the University of Wisconsin hospitals and clinics and makes us a leader in screening for colorectal cancer is our ability to look at our practice, to continually improve that, and constantly say to ourselves, what can we do to do a better job taking care of patients?
The original concept of the Digestive Health Center was to bring together multiple specialties to improve the care of our patients. Now that the center has been active, we believe that has really made a significant improvement in the care of many of these diseases.
It is this comprehensive approach that combines our strength at the University of Wisconsin in basic sciences and in clinical practice that makes us a leader in digestive health in general and in the care and investigation of patients with colon cancer.